So, hello everyone. Welcome to another session of Startup Grind from Pune, India. And we are very excited to have today's guest with us, Vega Paithankar. And Vega is a enthusiast and expert in the blockchain community. He has been working in blockchain and healthcare for, I think, more than a decade. And when I got in touch with Vega, I was really excited about knowing and learning from him, because I think blockchain and healthcare, both things are at a place where disruption is happening at a faster pace than anything else. So I'm very excited about this session today, and I am thinking probably all of you are thinking the same. So without much ado, let's deep dive directly into the session. Vega, would you like to start by a quick introduction about your work, about your interests, and how has life been till here? And then we'll keep on going further deeper into the topic. But first, would like to know the guy behind all of this.
Sure. Thank you very much, Ayush, and thank you, Startup Grind Pune Chapter, for having us today. It's a great pleasure, and very excited to talk to an eager audience about what we're doing and in what ways we hope to improve the state of healthcare. So for myself, I have a software engineering background, not a healthcare background. I have worked at companies like Sun Microsystems, which was later acquired by Oracle, in Silicon Valley. That was for about 10 years. And then after that, I worked at Google, doing things like search and big data for another 7 years. And then a few years ago, I decided that I wanted to work in the blockchain field, based on what I had learned about it, and just the potential that I saw in this new technology. And so it was not long after that I joined up with the founders of dHealth Foundation. And what we are trying to do is build a blockchain, and a blockchain-based platform for decentralized healthcare applications. Now, what I can see from the chat is that there are some people who are interested, who are already aware of blockchain, the technology itself. There are others maybe not as familiar. So I think what I will do is, instead of making this into a very a deep like a deep dive into either blockchain or like the dHealth solution, I will just start by describing sort of what blockchain is and how it fits in to the healthcare vision that we have. And then we can, based on audience questions, I very much hope that this will be very interactive. So based on the questions that the audience might have, we can just take the discussion wherever it goes. I hope that's okay. I know it's not exactly
Sure.
the format that was
Sure.
described on the event page today. But I personally think the discussion will be a lot more interesting if it's interactive. I also quickly want to mention my colleague and dHealth's India lead, Claudius Lazarus, who's here today in the audience, and he was instrumental in in making this session happen. And if there are questions specifically about what dHealth is doing in India, or about how entities in India can work with us to build interesting healthcare applications, I will be more than happy to defer to Claudius. I'm also going to, I think, stop my camera at some point, because it keeps warning me that my internet is unstable, and I think video takes up too much bandwidth. So you let me know, Ayush, when I can go ahead and sort of launch into it.
Sure. I think, I think let's get started right away. On the camera side, I think you take your call whenever you feel like, if your computer is facing issue. But I mean, if you're comfortable, you can keep the camera on. Either ways is okay, I think. And then just to share with all of the people, just like Vega, you said, we tend to make these sessions as much interactive as possible, and also want to make sure that we are able to cover as many questions as possible for people. So people, please feel free to keep putting your questions, And I think we'll taking questions from the Q&A section on the chat. So please keep adding whenever you feel like you have any questions. So that with that being said, I think Vega, why not we just start with the simplest of the thing, like
Yeah.
the applications of blockchain. What is blockchain? Probably let's start with that, and then moving towards its application in healthcare. I think I'll
Uh,
give the
uh,
stage to you.
yeah, absolutely. No, absolutely. I think that makes sense. A lot of people have, I imagine, they've heard of Bitcoin and Ether, and obviously with everything that's going on with Twitter now, I'm sure people have heard about Dogecoin and how Doge is going to take over the world. A lot of people have heard that Bitcoin or cryptocurrencies in general are in some ways from a regulatory point of view problematic. There's some people have this perception that only criminals use it to avoid being detected by financial regulators, whereas other people think that this is like the greatest thing since sliced bread. So I think what I will do is I will quickly sort of set the background for what blockchain is, and then get into what that means for healthcare and how our vision plays into it. So let's quickly get back to Twitter, actually, since I mentioned Twitter and Doge and some weird relationship that exists there. But what is Twitter in a way? It's an announcement platform, right? You have an account which may or may not be in your real name. In fact, I would say that more than half of Twitter accounts are not in people's real name. So you have pseudonymous accounts. The account handle is a pseudonym. What you're able to do with that account is you are able to read what other people are posting, and everything that people post is in the public domain. There's no such thing as like a private Twitter channel, right? The other thing you can do is you can post small announcements yourself. And when you make those announcements, they are tagged with the date, with a timestamp, and they are tagged with your identity, your Twitter username, right? And so what that means is that you or anybody else on the planet can essentially communicate with everybody else on the planet on a completely public open forum by making these small announcements. And nobody else can post on your behalf unless they have your account credentials. The only issue is, let's say Twitter doesn't like something you are saying, then they can just block you. Or if Twitter thinks that its algorithm decides that your interest seems to be more on one subject than the other, then Twitter can unilaterally decide to prioritize what to show you. In other words, even though it is a public forum in which you can post with your pseudonymous identity, there is a centralized sort of gateway that can block you or that can selectively hold back information from you. It's in many ways similar to what you would see when you put up classified announcements in a newspaper. Right? When you put an announcement, it goes on a public forum, which is the announcements page in the newspaper, and it's there forever. And the only problem is that, and you don't know who's reading it. It's once it's out there, anybody can read it at any time. The only problem is that if the newspaper doesn't like what you're saying, then they can block you. So that creates that basically presents. Sorry, go ahead. Was there a question?
No, apt example. Okay. I was saying. Yeah.
Right. So now imagine that you had a forum that was not controlled by any entity, right? Where nobody could gatekeep you, or could block you, or could block content from you. Which means that it would have to be some sort of a publicly operated utility in which nobody had any rights. So that is essentially what a blockchain is. I mean, I'm restricting myself to public blockchain now. A private blockchain is basically just like a database. So in a public blockchain, essentially what you have is participants who are able to send messages, which are then relayed across a lot of different participating servers or machines or nodes on that network, and put in a public table. And then they are all time stamped by the time at which they were put in that table, called the blockchain. And essentially that constitutes a messaging layer. And once you have that, it has a unique property that once you put a message out there, because it gets relayed and replicated on all of these different nodes, it can never be modified, because you can modify your own local copy of it, but there's like 1,000 other nodes in the world, and you would have to go in each of those 1,000 nodes and modify it so that the whole world sees what you want to modify rather than what was originally written to the blockchain. By the same logic, you cannot delete something that was written to the blockchain at any given point. So this idea of immutability and non-erasability. Once something is written to the blockchain, you can only add new information to it. You cannot modify or delete old information. I think that's a very, very different and very powerful way of storing and accessing data compared to the traditional things that we're used to, like databases or web servers, things like that. And so, of course, that has applications in the form of cryptocurrencies, because what is a currency transfer? It is a message to the public that a unit of currency which belonged to one entity now belongs to another. And if everybody recognizes, then that makes it so, right? It's because there's no physical cryptocurrency. A cryptocurrency is just a state, the virtual state of the blockchain. So when you create a message that says, here's my proof that that I am the owner of these tokens, and here's my message saying that I'm transferring these tokens to the next person, then from that point on, that person becomes the new owner of those tokens. And every node then keeps track of who owns what, and that creates the basis for essentially a peer-to-peer currency. And what keeps you from making a fake transaction? Well, there's the mathematics behind it, which is called essentially a digital signing algorithm. And what that means is that your identity takes the form of a private key, sort of think of it like a password, and a public key, think of that as your public identity. And any message that you create is signed with your private key and is broadcast along with your public key. And anybody who wishes to verify that the message you sent is really from you, all they need is that message, that public key, and the signature that you generated using your private key. They don't need to know your private key, but they do need to see your public key, the signature, and the original message. And then you run a computer algorithm called the digital signature verification, and then it tells you, yes, this person is entitled to make this transaction. If they are not, then all of the nodes, that is the protocol of the network, that is the program that's run by all the nodes and all the wallets, they will automatically discard any message, any transaction that does not have a valid signature. So that ensures the notion of ownership. Right now, that's great for currency. What does that have to do with healthcare? And maybe at this point, I can start sharing my screen. Okay, and unfortunately, it is now telling me that I have to potentially restart after approving the sharing of the screen. So I may have to do that. So if I disappear just for a moment, don't worry about that. I'll be right back. I may have to restart Chrome.
Okay.
So what does that have to do with healthcare? So our vision basically is that healthcare currently is very, very data driven, right? Whether it's development of new drugs, whether it's managing sort of your healthcare record, whether it's analyzing which treatments work or not, it is very heavily data driven. And then the question naturally arises, where does the data come from? Where does it live? And how does it get used by the people who are interested in using it? So obviously the data comes from places like diagnostic labs, like your hospital, the doctor that is making notes in your records every time you get an x-ray. Sometimes it's data that you yourself might generate. For example, you might wear a wearable heart monitor that records your pulse rate and essentially a portable ECG, so that your cardiologist can look at it the next day and figure out if there's some sort of abnormal activity. It can be data you report yourself based on answering questions about your health. So data comes from a lot of different sources, and currently it lives in a lot of different places. The most common place is your hospital's or your doctor's patient health record system. And then, of course, it's stored in some format that is unique or specific to that, which means that if you have to take the data from one provider to another, that doesn't work. So I'll give you a second to think about sort of the implications of that while I restart this session, and I'll come right back. Sorry about that.
Okay, let's have Vega join in back. In the meantime, people, if you have any question that comes to mind right away based on what Vega already shared, please share on the chat or on the QA, rather QA part of the chat. It would be helpful and we can take those questions.
Okay, thanks. I guess I am back. Let me know if you're unable to hear me. So now let me try
Can hear
and
you. Mhm.
sorry, go ahead.
Yeah, can hear you. Yeah.
Okay, let me share my screen. Um, so as I was just mentioning, all this data lives in different systems, and it uses different standards. I mean, there's like 10 different standards that I can think of, in which the data is stored. So, I mean, by standards, what I mean is, what are the files called? How do you encode sort of what condition or disease the patient has? How do you identify which medical procedure was performed, and things like that. So there's all of these different standards like ICD-10 and FIHR and so on. And a lot of them are not mutually compatible. In fact, most of them are not compatible with each other at all. So if one system stores the data in one format, and then it has to be consumed in another system, then you usually need to write some software that converts from one format to the other, which, as you can imagine, causes a lot of friction. Apart from the technical issues, there's also a lot of regulatory and legal issues around sharing of health data. So, for example, a lot of countries, like in Europe, they have, which is a very, very, very comprehensive privacy regulation that essentially makes it very difficult to share private information that you hold on behalf of your user.
Vega, sorry to interrupt. Are you would you like to share your presentation because we can't see anything if you are
Oh
presenting?
yeah, I am. I'm trying to get it to
There
this.
is a share screen button. Is that not working at all? Because
No,
I
the
see
share
a
screen
share.
button is working. It's
Okay.
asking me to share either a tab or a or. So let me do this. Let me just make it easy and share the whole window.
Yeah, should be fine. I'll let you know how it looks and if we see any trouble.
Okay. So share the whole screen. Share. Okay, let me know if you are able to see my screen now.
Yes, we can.
Okay. So as I was saying, and I know that some of these slides have a lot of text in them. Don't worry about, you don't have to actually read the text. I'll just use that more as pointers for me. The slides that are coming up next will hopefully be a bit more useful. So essentially, there's all of this fragmentation, the regulations around sharing of data. Now, and if you can think of sort of all the things we could do if we could easily share health data. I think, imagine if a research, not me personally, but let's say a pharmaceutical company or a healthcare research company had access to a lot of cancer patients' data. Then they could do a lot of data mining to figure out what treatments work, better than others. If it's a rare cancer, then for the company that's developing that drug to find sufficient numbers of patients to get their data is very complicated and very expensive. And then because the cancer is rare, then they have to talk to a lot of different healthcare systems individually, and then make sure the data is in the right format and do all the sharing agreements and so on. So you can imagine how inefficient all of this process is. And then if you think about why people should make all the effort to share it, to share all this data from your system into another system, you don't really have an incentive. And as a result of that, we can see that a lot of medications for rare diseases are very, very expensive, take a very long time to develop. And in fact, many diseases have been declared orphan diseases simply because nobody is creating any treatments for them. There's some other issues in the healthcare data as well, which is that it doesn't even exist except on pen and paper in a lot of places. And obviously that makes it that much harder to share. I already talked about silos and interoperability, and then the privacy concerns that make it difficult to share the data. So what can we do? And in particular, why did we look at blockchain as sort of a way to break out of this? So remember the thing I talked about where every transaction on the blockchain is essentially a message sent by the owner of an account, the pseudonymous identity. Right? So that basically means that you could have a system of identity where the patients are the owners, and the thing that they agree to share voluntarily is their data, and then they can share that with specific parties that they want to share it with. But essentially, the identity and access control aspects of the blockchain makes it easy to give patients the control over their health data. Now, what would happen if we essentially do the same thing with a private blockchain or like a database? Well, then the patients are at our mercy, or whoever does it. So basically that reduces the trust in that blockchain. If the single party that owns that infrastructure can censor people or limit the use and application of the data, then that defeats the purpose of openness, and again brings in another point of friction. So having an open and decentralized blockchain infrastructure is a very powerful alternative to the current way of doing things, which is very centralized and controlled entirely by hospitals and in many cases governments, and whoever has the right, whoever has the privilege of either allowing you or not allowing you access to their database. So with a blockchain, there is no database, there is no permission. All you have to do is establish your identity, and you have then the right to transact, to essentially move your data around. So that is our vision at a very, very high level. And before I proceed, I just want to make sure that there are no questions specifically about what I've described so far. So, okay, so I just skipped a super verbose slide that just goes in depth into that comparison of the old centralized way of doing things versus the new decentralized way of doing things. But instead, I want to go straight to sort of the big ideas that we hope to bring. And by the way, I know this is all coming from dHealth, so we're very interested in sort of making the case that dHealth is sort of solving this. But any blockchain solution, I think, would be beneficial at this point. So anything that we say here that dHealth is doing, you can imagine that it can be done with any blockchain protocol in general. It's just that we are specifically targeting healthcare as the use case. And trying to tune and optimize the incentives of all the parties. But everything I say here, like identity management and data storage and payment, obviously you can do all of those with any blockchain. So please don't consider this like, shilling dHealth too much. But let's talk about identity. So basically, on a blockchain like dHealth, every patient and every entity, like a healthcare provider, an insurance company, a pharmaceutical company, or a government research agency, they would establish their own identity using what is called a wallet. A wallet is essentially a key management software. And then consent is basically in the form of a signed message from that identity of the owner of the data that says, yes, I consent to share my data with whatever party wants it. And that proves as a record, an electronic record of that consent, so that, for example, your hospital won't get in trouble if they share your data with a third-party researcher with your consent. If they did it without your consent, then they would get into trouble with a lot of privacy regulations. It is so it's not enough just to have consent. Obviously, the data itself, if it's in silos, then that's not very useful. So another big pillar that we are building is a decentralized data storage, where think of Google Drive or Apple iCloud or whatever the Amazon so Microsoft solution is, where with your account you have an associated a certain number of gigabytes, and you can store your files there. Except obviously in each of those cases, it's either Google or Microsoft or Apple that is controlling, in a centralized way, that data storage. So what we're hoping to build on top of the blockchain layer is a decentralized data storage, where your blockchain identity would automatically imply ownership of specific files that are assigned to you. So it'll be just like a decentralized Google Drive, essentially. And then the third pillar is payment systems. And by payment, I mean both fiat payments in rupees or euros or dollars, but also things like utility tokens, NFTs, tokens that sort of, that are application specific, that identify not a monetary value, but identify some sort of, let's say participation in a clinical trial. So by the possession of a specific NFT would grant you access to take certain actions in that decentralized application. And I know this gets a little bit complicated, but just imagine that this is some sort of a multi-user game in which you have different identities, and all of those are controlled by your primary dHealth blockchain identity. But then with each specific identity, in other words, ownership of an NFT, that unlocks different application uses for you. And our emphasis is on building a completely open, global, community-operated blockchain where we don't own the servers ourselves, so we can't control or censor anybody, and that hopefully will increase trust in the system. And we've had a reasonable amount of traction in building up this decentralized public blockchain. So there are entities, some of them you might have heard the names, like Roche and Lilly. There's obviously some other well-known universities on this list that are all participating in running of this network, supporting it, and in fact even building decentralized applications on top of the dHealth blockchain. So the blockchain at its heart consists of nodes. Nodes are essentially servers that are running the dHealth node software. And these are servers that receive all the transactions that are broadcast by the users, put them together into blocks, and announce them and relay them to the rest of the network of nodes periodically. In our case, every 30 seconds. But for example, Bitcoin has a approximately 10-minute block interval, where every 10 minutes you put together all the transactions that are pending and announce them as a block. And there are various reasons for doing it block by block instead of transaction by transaction. But the simplest is that when you block transactions together, it makes the verification, the validation that much easier. Otherwise, you'd have to do it if a block were to contain 1,000 transactions, then you have to do it 1,000 times instead of just once every 1,000 transactions. I could go into the performance details of specifically of dHealth network. I don't know how interesting it is to this audience. So some of these slides are more intended for the potential participants in the network, but I'm more than happy to get into the details if there are questions. From a user point of view, essentially everything is controlled by what used to be called a wallet, but we prefer to call it the signer app, because with wallet, a lot of people naturally think about currency, money, and things like that. But essentially, the functionality that we need the most is creating digital signatures that validate whatever data transaction that you are announcing, that you are enabling. So the dHealth Signer app will then connect to any application that anybody has designed, and be able to manage the identities and access rights to the data, as well as token balances, whether they are for the dHealth native token or for NFTs or other custom tokens that may or may not be of monetary nature. All of our APIs, SDKs, so software interfaces, are public and open on GitHub, so anybody can build applications they're interested in building, and they don't need our permission to do that. And we are hoping with this community, as well as all the other communities that we talk to, that we will attract a lot of developers to build interesting healthcare and fitness applications on top of that. So one of the applications that we ourselves have built is a health pass, and maybe this is a good point to sort of take a quick retrospective look at what we have just lived through during the pandemic, and how health data was one of the the critical parts of just being able to live normally through the pandemic. So the obvious example is vaccine passes. We all have them. We've all used them. We've all shown them, whether it's to catch a flight or enter buildings that have these controls. Restaurants in many places required scanning of the health pass. So in a lot of jurisdictions, in fact, I would say in all of the jurisdictions in the world right now, your vaccine pass lives in some centralized system. So in Europe, for example, each country has its own centralized system, and then the vaccine pass is then signed by the private key of each country's individual system, and then they all go through the central European gateway. When you want to verify somebody's QR code, then the verifier application sends a request to the centralized gateway. It then checks that it is signed by the correct key that is registered with it, and then it will tell you, yes, it's valid, or no, it's not valid. Now, if that server were to go down, or if for whatever reason somebody were to hack into it and delete all the records, then suddenly your vaccine pass is not valid anymore. It's not usable anymore. It cannot be trusted anymore. So we think that by having this data in a decentralized data storage that is controlled by you, and that is recorded, the ownership or the attestation, the verification data of that is recorded on the blockchain, you can then take your vaccine passes or your test passes with you on your cell phone, and without sacrificing your privacy, because what is stored on the blockchain is essentially the verification code for it. Think of it as some sort of a checksum. And if the checksum matches, then it's considered valid. And the checksum itself doesn't reveal any private data. And this is a real application that we have built, and we have been testing. So it's a very powerful way to show how, even if, for example, the lab server goes down, you can still show a valid vaccine certificate. Again, I'm going to skip one slide. Health2Earn is, I think, our most popular decentralized application. If you go to our website, dhealth.com, there's a link to Health2Earn. And the way this works is very simple. So we want to reward people. We want to incentivize, encourage people for living, in a healthy way. For example, by doing regular exercise. So currently, if you, let's say you like to run periodically, or you like to do some sort of a gym workout, you can download a lot of health tracking apps. So Strava is a very popular one. It also has like a social aspect to it, where you can follow a lot of friends on Strava and see what activities they are doing, and hopefully that encourages you to be active as well. And then so what Strava can do is, once you record an activity, it can then trigger a request, assuming you have downloaded the Health2Earn app from our website. It then tells the Health2Earn app about the exercise that you just completed, with obviously some sort of a verification message, which is then sent to the Health2Earn server, and then the server sends you tokens. What it boils down to is, you can go for a run, and as a reward, you can get some dHealth tokens. Someday those tokens will be worth millions of dollars, but for now they are literally that, just a token with a very small value as a demonstration. So I'd encourage all of you to go to dhealth.com, click on the Health2Earn link, download Strava. You can use Strava even without dHealth. Strava is a completely separate app. We don't have anything directly to do with them. We just piggyback on top of their APIs. And so this has so far proved to be our most popular decentralized app. A lot of people regularly record their workouts and earn some DHP that they can boast about. If there's interest, I can dig up a video of how it works, but it's literally as easy as you imagine. You download the app, link it to Strava, and you're done. Another app that we have used is called Sentiva. And so unlike the previous case, this is directly to do with healthcare. And the problem we're trying to solve here is how do you encourage people, especially patients of rare or difficult diseases, to provide feedback to their healthcare provider on how well their care is working for them, how well the treatment is working for them, or the medication they're taking is working for them. So the way this works typically is we work with a hospital or a healthcare provider or a patient advocacy group, and then have them enroll their patients into downloading and installing the Sentiva app. They provide some basic information about themselves, like where do they live, how old they are. And again, that information stays within the app. It's not sent to any server. We're very conscious of data privacy there. And then a researcher, for example, could broadcast using the blockchain a request to these users to share their data. And each request will be accompanied by the real world identity of which lab or which pharmaceutical company is requesting that data, what they're requesting it for, and in what way are they willing to compensate or reward the individual for taking the time to answer their questions or to agreeing to share their data. And so for example, if I am trying to come up with a new treatment for diabetes, I would create a request that says, I want all the patients living in Pune between the ages of 50 and 70 who have type 2 diabetes, and broadcast it on the blockchain. And those users' app will then notice that transaction. As I said, the blockchain is a public and open database that is continuously updated with blocks of transactions. So the app will monitor the blockchain. When it sees this request, this announcement, it will match the criteria with the patient's profile that's stored locally. And if there's a match, then the patient gets a notification saying, hey, there's this new study going on. This is what they are looking for. This is who it is that's asking for it. So you can tell, do I trust, is this a marketing or advertising company, or is it a pharmaceutical company? Do I agree with their purpose of why they're asking? And then if you agree with it, then through the app, you provide your consent. And then you're directed to a place where you can answer the questions. The answers go directly to the entity that's asking for your data. The app or dHealth doesn't store the data ourselves. The data goes directly to the entity, the researcher. Once the researcher gets the data and they verify that all the answers look valid, then they send the reward tokens to the patient. And what we have found out is that normally if you do healthcare surveys and ask people to provide feedback, you get maybe a 10 or 15% response rate. But in some of the pilots that we have done in countries like Vietnam and Ukraine, before the war, we got up to 80 or 90% response rates from patients who had downloaded the app. And so obviously the data is a lot more relevant and useful, and very low friction, because all the parties have incentives that are aligned. So I hope that I'm painting a picture of sort of how interesting use cases are possible with the blockchain. I'll take a very quick pause here and make sure that if there are any questions of the things that I've discussed so far, because the next thing I want to do is talk about some more ambitious things that we are in the process of building. So let's hear it if there are any questions, please. You can also type the questions in the chat, because I think only the hosts are able to actually speak. So let's look at what are the other cool things that we can do. I already mentioned incentivized real-world data collection for treatment monitoring, treatment compliance, so encouraging people to stay current with their medication. So this is a project that we did with the National Lung Hospital in Vietnam, and as you can imagine, that was before the pandemic. And the problem that they were trying to solve is when people get sick, get diagnosed with tuberculosis, then they start their treatment. A lot of times the treatment makes them feel better right away, and then they stop taking their medication. And then the TB comes back because they did not complete their course of medication. And when it comes back, it has become resistant to treatment. And that's a much more dangerous form of the disease. So what we found is that just by periodically sending them reminders and asking them how they were feeling, and if they are still continuing their treatment, that's the potential for a successful completion of the course of their medication, of their treatment, is much higher. So it really has the potential to improve the outcomes of the tuberculosis treatments. Now, I remember when I mentioned that a blockchain is basically a set of time-stamped messages that are accompanied with identity. Well, it turns out that is the perfect application for supply chains, essentially, or supply chain tracking. Essentially, if you want to know when things are moving through the supply chain from a manufacturer to a distributor to a regional distributor to, for example, a pharmacy, then to a clinic, and then ultimately to the patient, right? All of those are events that happen over time. And at each point, that medication or that vaccine is in somebody's control. And so they are nominally responsible for them. So in this case, in the West African countries of Mali and Ivory Coast, we are using it to track the supply of the rabies vaccine. The rabies is, unfortunately, it's a disease that kills a lot of patients. By the way, I just want to quickly say I do see your questions. I'll come right back once I describe this particular use case. So with rabies, it's very easily treatable if you treat within, like, say, 24 or 48 hours of a dog bite, as long as you have the vaccine available in the clinic where the patient goes. So one of the problems with the supply of the rabies vaccines is that it frequently gets lost without any record of what happened to it. Sometimes it gets diverted to the black market. Or sometimes it just runs out and nobody knows until it's too late that, oh, in this hospital that's 200 kilometers away from any city, they don't have any supply anymore. It's going to take 3 or 4 days before we can deliver vaccines to them. So it would be better to actually have an advanced warning of things like potential losses or potential shortages of vaccines, so that we can fix it before patients unfortunately get sick and die from this. So we use the blockchain as the supply chain tracking platform, where the supplier, the distributor, the pharmacy, the hospital, they all, every time they receive a shipment or they forward a shipment or they administer the medicine to the patient, they create, with their verified identity, they create these messages, these records on the blockchain about what's happening with each dose of the vaccine. And then the sort of the management of this program can run verification programs which audit continuously in real time, audit the state of the entire supply of the rabies vaccine, and can take necessary preemptive actions. Health certificates I already talked about. Health to earn I already talked about. I'll come back and talk about staking, but let me quickly take the question. So the first question was, what are the pain points for patients when creating data? I would say, well, I mean, if it's patient-provided data, like answers to their questions, I would say that the main thing we've noticed is that a lot of surveys, let's say you're a TB patient and you have to answer a survey every month. Then there's a lot of repetitive information that is requested, like, where do you live, what your age is, and so on. So if we had some way for the patient to store that data, and again, we don't want to store it in any storage that we control, because then we are liable for the privacy of the data. So I think just in general, the security and privacy of the data is a big pain point, no matter who's controlling the data. If it's the patient themselves, obviously they're not, information security experts. Most of the patients, naturally tend to be, on an average, elderly. As you get older, you're more likely to become sick and to experience all kinds of illnesses. That's just the way it is. And of course, the people who are older tend to be less comfortable with technology, especially when it comes to how to safeguard their information. So I would say that's definitely one of the pain points. And we haven't even, in the real world, we haven't even tried to see how well it works out if a patient walks into a hospital and after the visit, in some form, they receive a copy of their health data, right? So I think that will create its own set of challenges. When a patient receives a request, how will they know what exactly to share? So I think just that awareness and that familiarity with technology and with data privacy is going to be a huge issue. But I think the alternative is not much better, right? Because if your data is stuck and you need to go see a different specialist, then it's a big hassle for the second specialist to call the first physician and then figure out in what format the data is and how it can be transferred over. In a lot of countries still, the X-ray lab will just give you your X-ray, your physical, plastic X-ray, and then you take it to the radiologist to get it read. It would be much easier, I think, especially because of the mobile penetration, like smartphone penetration is so high. We hope that even though right now it seems very tricky, that people will become more comfortable with technology. What are the risks or limitations? I guess I see that as a broad question by itself. So I would say, yes, the obvious risk is that the patient or the user, doesn't know or isn't able to verify who's asking to share their data. Another is, we all know what it's like to lose the password to some service that we are using. Now, imagine you lose the password that controls your patient identity, right? The password to the Signer app. And that is a serious problem that we're still in the process of figuring out what's the best way to manage it. So both the unauthorized access to the data as well as just the loss of data, privacy and security are both risks. In terms of limitations, I think the biggest limitation is just inertia. It is very difficult for players in the healthcare industry to agree to change the way they do things, and especially when it's something that they are not familiar with, like blockchain, to suddenly go up there and say, hey, look, there's this cloud storage controlled by blockchain. We want you to take all of your patient health records and put them on this blockchain-based storage system. I think that's going to be a very difficult case to make to them. But we're hoping that by targeting, more receptive audiences, like, patients of very rare diseases, or in markets where both the healthcare providers and patients are reasonably comfortable with digital technology, that we will slowly open the door there. The last question from Ken about, what about the private data? How are they protected? There are two types of data that a researcher can request. One is self-reported data, which is when the patient themselves answers questions about how they're feeling, how many episodes of pain they had, for example. And then there's verified data, which is, currently, which would be stored in their healthcare provider's database, and the patient would provide consent, and there would be an arrangement in place between the provider and the researcher to share that data. So the app itself, or the owner administrator of the app, which is dHealth Foundation, we ourselves never touch the data. So that the data goes directly from the patient to the provider, or directly from to the patient to the researcher, or from the healthcare provider to the researcher. And in fact, in many of the cases, the healthcare provider is the requester of the data, because they are monitoring their own patient's experience with their treatment. So I would say that we try not to solve the the privacy problem ourselves, but we give patients the control over their own privacy, and make sure that we give them the tools, like verifying the identity of whoever is requesting that data. Let's quickly go into sort of what DHP and NEM or XEM is. So basically, you've all heard of or are very familiar with blockchains like Bitcoin, Ethereum, Cardano, Solana. Each of those are essentially variations of the same idea, which is decentralized peer-to-peer networks secured by cryptographic identities and digital signatures. So NEM, which is a blockchain that was also that's also public and decentralized, is targeted towards not things like smart contracts, but a very low cost and a very high bandwidth, a very high number of transactions per second. So in case of dHealth, for example, every 30 seconds, we can have blocks that contain up to 4,000 transactions. So we can do 4 to 8,000. By transactions, I mean just these messages. They could be currency transactions, or they could be transactions that reflect a transfer agreement to transfer data, health data specifically. So NEM focused on high bandwidth and high trust in the form of a proof of stake algorithm, which we took and converted into some sort of a proof of stake, but with several trusted entities. So I mentioned Roche and Lilly as being the supporters, or the MIT IIT University in Pune. So we go to a lot of these trusted establishments across the world and in different sectors, and have them oversee the network and run nodes. So no single party, or it has full control over the network. Roche and Lilly are competitors, yet neither is able to censor the transactions of the other or lock the other out from using the platform, which naturally builds more trust into the system. So why NEM? Well, because Bitcoin is too expensive and Ethereum is too unpredictable and too heavyweight. And I don't know if you followed sort of gas fees. Sometimes it can cost like a couple $100 just to make a transaction on Ethereum. And given that we're targeting healthcare, patient-centric healthcare, we definitely want very, very low cost or even free transactions and a very high volume of them, as well as a measure of trust. And so that is what we're hoping to achieve with the dHealth network. But thanks. These are all great questions. So in terms of community, I'll quickly talk about what we're trying to build and what our hopes are for how we will build out the network. So anybody who runs a node is able to create the blocks, and as a reward for keeping the network operational, they get a share of each block reward, which is essentially the new dHealth points, which is the native currency of DHP, of the dHealth network. So every block that is generated comes with newly created DHP tokens, and then the node that, based on its share of the total coin supply, it'll proportionally get a share of the newly created tokens as well. So that creates an incentive for more parties to install a dHealth node, acquire some dHealth tokens, and continue to create blocks. Another way in which we hope to grow the community is by partnering with universities. So just this week in Pune, we met with a lot of students from the MIT IIT University that's in Loni, and we are actually bringing on board up to 20 students who will be building different types of applications that are all health or wellness specific on top of dHealth. And some of those will actually formally be interns that are funded by dHealth. Many of them will just be volunteers doing this as coursework or to gain experience. And our hope with this community today is that some of you will join us in running nodes and in building decentralized healthcare and wellness applications. We are also in the process of building the signer app that I described, and the patient-controlled decentralized data repository or data storage system. And in fact, it's primarily being built by the students at MIT right now, and we're very excited about that. And we are working with the University of Basel in Switzerland, as well as the health and veterinary ministries in a couple of African countries to build the rabies supply chain tracking application. A lot of people are very interested in digital, sort of smart contracts these days, and we're also hoping to build smart contract functionality, not in layer 1, but either through a bridge or on top of the decentralized storage. So it will not be part of the layer 1 protocol, but you could still trigger the execution of a smart contract by making a dHealth layer 1 transaction, and then feeding back the results of the execution of the smart contract in terms of another transaction that would be visible on the dHealth network. Stable coins are also very interesting, and we are definitely interested in supporting that use case, especially for healthcare reimbursements across borders. So a lot of pharmaceutical companies have patient support programs for patients of rare diseases who cannot afford thousands of dollars in medications every month. So the pharmaceutical companies will happily fund their course of medication. So the way this works is that the patient will present their patient support program card to the pharmacy. The pharmacist will sell them the medication cheaply, but then they will get the reimbursement from the company that's sponsoring the patient support program. Frequently, all of those entities are in different countries. Like the pharmaceutical company could be in France, and the patient could be in Poland or in South America. And so going through the banking system has its overheads, delays, exchange rate charges, and so on. And we're hoping that if we could have a global stablecoin that's linked to all of the decentralized applications on top of dHealth, that it would simplify a lot of that part of the value flow. I think, let's see, I think those are pretty much all of the slides that I was planning to go through today. I have a few backup slides that I could go through, but I've already taken up a lot of time, and looks like there's one new question, but we'll open it up to more sort of interactive audience discussion now. Exchanges where DHP is listed, and how do you acquire DHP and how do you trade it? So I don't know if all of you were around in the sort of crypto sphere just a few years ago when the ICO craze was happening, where essentially what was happening was a lot of people were cloning some existing blockchain project, giving it a new name, coming up with a new token, getting it listed on an exchange like Binance or Gate.io or whatever. And then as soon as a new token came on board, a lot of users would speculatively jump into it. But then the promoters or founders would then sell all of their initial tokens, make a quick buck, and the project would just die, and the people who did the pump and dump scheme would run away. We definitely did not want to go that route, so we did not prioritize listing of the token over building out our ecosystem. So that has been our focus. And so there's currently one decentralized exchange and one centralized exchange, MEXC and Uniswap, where you can, if you are so inclined, where you can exchange your Ethereum for an ERC20 token that represents a DHP. And then we also have a bridge where you can send the ERC20 and get the native DHP if you wanted to stake. As the ecosystem grows and the user base grows and the interest grows, we're hoping to expand that, and we're actually hoping to have a listing of the native token as well. But in our experience, just the listing itself is not enough. The token will only have value if it has users and use cases and adoption. So we are definitely much more focused on adoption right now than we are on listing. And it's very easy to get a small amount of DHP if you want to get started. Just install Strava, go for a run, and you'll get like 10 or 20 DHP just as an encouragement. And you can do that every day. But if you are interested in acquiring more DHP, potentially running a node and staking, feel free to reach out to us. In the short term, in the long term, you'll be able to acquire the DHP directly, but in the short term, we'll be more than happy to work with you on that. About how the data storage works. Yes, you mentioned IPFS. I think that's very insightful of you. So for those who are not very familiar with it, IPFS is essentially very similar to blockchains, except it's static. So what happens is you create, let's say you have a file and you upload it to some server. It promises to keep that file for you. And it does a checksum of that file, and that checksum becomes the identifier of that file worldwide. And then it also tries to replicate that file to other nodes. But once you have a file and you compute its checksum, that becomes its name and its identity forever. If you change the contents of the file and upload it, the checksum will be different, so it will get a new name. And so anybody who's looking for that file with the old name will get the old content. So IPFS is great. It's very useful, but it is static. It's a static picture. For a realistic file system, as you and I are used to, you need a versioning layer on top of that. You need to be able to modify files. You need to be able to organize them in folders. You need to be able to copy, delete, all those kinds of operations that we're used to doing with files. Share, especially, obviously, that's sharing a file with specific people is very important to us. But we also don't want to depend on any kind of a centralized data storage like Google Drive. So what we have done is built a blockchain-based versioning layer on top of IPFS. So essentially, every time a file is modified, it gets a new IPFS identifier. And we create a new announcement with the file's name. Each file has a name under the dHealth file system, and then the latest IPFS locator of that file will be announced on the blockchain. So you look up that name on the blockchain, and you see all of the different IPFS locators associated with that file. Those are all timestamped. And if you're on the latest version, you look at the latest transaction that updates that file, and get its IPFS locator, and then get the file from IPFS. So it's an idea that's been done before. There's a lot of different projects like Proxima X and like Filecoin that are based on the same deal. IPFS itself has something called IPNS that tries to do that as well, but it's not blockchain based. But yes, we're hoping that by adding this versioning and access control layer, that we'll be able to use IPFS in a much more useful way.
Okay, I think we may be running short on time, Vega. So
sure.
Unless there's any other last question, I think though it has been a really insightful session, unfortunately we'll have to wrap up the session here. So yeah, anyone, any last question? Maybe we'll take just one last question if there's anything. So I have one last question, Vega.
Please.
If anyone wants to connect further with you, what would be the best channel? Where are you available most? And would you like to give a link to it? Whether it would be email, LinkedIn, or Twitter?
Absolutely, yes. So our website is very simple, dhealth.com. I myself am now I actually work for the foundation. The foundation the foundation's charter is to grow the ecosystem and to support the network, make sure we select strategically important partners that are trusted the world over, and make sure that the network remains decentralized. So my email address is not under .com but under foundation, so dhealth.foundation. And I just typed those two into the group chat. But yes, go to dhealth.com. There's links there to get in touch with us, or you can write me directly, vega@dhealth.foundation. You can also connect with me on LinkedIn using that email address.
Okay. Yeah, that sums it up. Thank you so much.
Well, thank you,
And
everybody.
thank you everyone for joining in. Thank you. Bye bye.
Thanks. Bye.